Going to be losing their health insurance because they're just not going to be able to pay the premiums anymore when the subsidies go away. So we're going to talk about those today and the alternatives. There are alternatives out there, but unfortunately, very limited circumstances, very limited eligibility. But we'll go through there, see if we can help as many people as we possibly can out finding those alternatives. Let's start at the bottom first. So across the board, looks like Medicare, Medicaid, the Affordable Care Act, all of that, they are slowly being cut back. Medicaid is losing about $1 trillion. Medicare, by the skin of its teeth, it almost got about $500 billion cut, but the continuing resolution put that off temporarily. So hopefully that doesn't come back again. But the Affordable Care Act, millions of people are going to be losing health insurance because of the Affordable Care Act. So by default, we as Americans have chosen a brand new health care plan for Americans. If you got money, then no issues. But for everybody else, the new health care plan is the emergency room and then bankruptcy. And because the emergency rooms, hospitals, they're going to take that hit because people can't afford to pay, hundreds of thousands of dollars, something that if they would have had health care, they could have taken their prescriptions and went to regular doctor's visits and kept whatever issues they have under control. But when people don't have health insurance, they don't do that. They let it get worse and worse and worse until they can't handle it anymore. And then they go to the emergency room and they can't afford it because it's 10 times more expensive in the emergency room, and they go bankrupt and the hospitals get stuck with that. And guess what? Its cost is moved over to everybody else, including people with employer health insurance and Medicare and everything. So that is the decision we are making as an American public, to choose the most expensive option possible. But okay, so in the meantime, for those people out there that can, let's talk about some of the alternatives. So let's go down. Medicare. All right, so if you're approaching 65 years old, you can go ahead and sign up for Medicare. That starts at 65. If you're currently receiving Social Security benefits, they essentially sign you up for that automatically at 65. A lot of people don't realize that you can also get Medicare early. You don't have to be 65. You can get Medicare at 35 or 30 or 25 or 45 or 55. If you have a disabling condition and you get approved for what's called SSDI, Social Security Disability Insurance. I ran the third business Social Security office in the country. I've personally taken hundreds of thousands of disability claims. It is a process. I've got a website, mygovexpert.com. You can go in there. It tells you about the disability process. We've got some retired Social Security employees that can help you through that process as well. But disability benefits. So Social Security defines disability as the inability to work. So your disability has to last 12 months or longer, or part I always hate saying, or end in death. So 12 months or longer, and your disability prevents you from working substantially. A lot of people out there can actually file for disability, but they think, okay, well, I can't file for disability benefits because I'm still currently working. And that doesn't necessarily matter if you have what's called, if you're working under what's called substantial gainful activity. So if you go into my website, the mygovexpert.com, 100% free website, one-on-one appointments we do charge for. That's the only thing we charge for. But it talks about eligibility requirements there, that you have to, the substantial gainful activity. And the substantial gainful activity for right now is $1,620. So all those people, if you're new to the community here, this is what we do. We talk about this information, we provide the information, the eligibility requirements for all this stuff. And if it doesn't apply to you, then great, awesome. But look out for those people around you. So if you know someone, a parent, a uncle, a niece, a nephew, or neighbor, or something like that, that is having a hard time losing their ACA, or just having a hard time keeping a job, and they have a job, but they're making under $1,620 for this year. Next year, it goes up to $1,690. But if they're making under that, that is called substantial gainful activity, and they can apply for Social Security disability benefits. There are thousands, probably hundreds of thousands of people out there that can actually apply for Social Security disability. but don't because, well, I am working part-time. I'm not making much because I can only work 1 or 2 days a week, or I can only get a low paying, job or something like that because of my disability. Nobody will hire me. So I can't apply for disability because I'm working. I heard that in order to get Social Security disability, you can't work. Incorrect. Substantial gainful activity. So please, let's reach out to as many people as we possibly can and help those people. Now that you're part of our community, that's your new mission in life, to do exactly that. All right. So, hey, if you need help with Medicare, Medicare Advantage, Medicare supplements, Part D plans, make sure you reach out to my partners at Chapter of Medicare. I looked for a place that would help y'all out, and Chapter of Medicare knocked it out of the park. They've got excellent customer service. They look at every single plan in your area, and their help is always 100% free. Give them a call, and they'll see if they can help you out, and tell them Dr. Ed said hi. That's for Medicare. Again, 65 or disabled. And then we have obviously Medicaid through the state. And a lot of people, there's about $1 trillion that's going to be cut out of the Medicaid budgets over the next few years. And those are administered by the state. So a lot of people, one of the reasons they supported the cutting of Medicaid, because a lot of people thought they're not getting Medicaid. That's because Medicaid, unfortunately, is called different things in different states. Access in Arizona, and Medi-Cal and Denali Care, and all kinds of different names. And they say, well, who cares? I don't get Medicaid. I get Access. Well, that's Medicaid. So Medicaid is low income, low resources health insurance. And you can have Medicaid and Medicare. If you are receiving Medicaid and you turn 65 or become disabled, you can receive Medicare and Medicaid at the same time. It covers a lot more. And then obviously there's CHIP, which is the Child Health Insurance Program, and those are also administered by the states. And if you go on my website, mygovexpert.com, and our brand new website, which is 24help.org, you can go in there, and there are a lot of group discussions that if you've got a question, you can help someone out. This is the place you go for Medicaid, Social Security, Medicare, food banks, and all the rest of it. This is a discussion forum for people out there to get help and help each other. So please use that. That's 100% free. All right. So Medicaid, and if you're eligible for SSI. SSI, people think it means Social Security income. It doesn't. It means Supplemental Security Income. It's a welfare-based program that Social Security administers. So SSI, you apply for that through Social Security, and who is eligible? Disabled or 65 and older. The max you can get from SSI this year is $967. Next year, it is just announced that it's going to be $994. So again, welfare-based program, low income, low resources. But the trick is, if you're approved for SSI, you're automatically eligible for Medicaid. So again, it's called categorically eligible. Okay, what else do we have out there? Some states have healthcare programs. I know New York, Minnesota, Oregon, there's state programs there. Definitely check out those particular state programs. Some counties have some type of health type programs as well. Obviously, the employer, if you're working and they provide health insurance, that's one of the reasons a lot of people don't have health insurance, is because their employers play games and they say, well, if I give you 40 hours, then I got to provide you all those benefits, or we're going to cut you back and hire more people. And so they use that, manipulative. Yeah. Anyway, we really needed to redesign the healthcare system in America. And COBRA, if you get fired or laid off from a work, everybody knows about COBRA. A lot of people don't get it because it's just unbelievably expensive. All right. And then there's also, through the ACA, there's called catastrophic plans, and those are ACA compliant. That means there are no, pre-existing conditions, and they can't kick you off if you get sick, and like it used to be before the Affordable Care Act. But those are catastrophic plans under 30, some type of hardship or something like that. So definitely check those out. You've got plans that are called off exchange, the Affordable Care Act. You contact insurers directly, but with those, essentially, there's no subsidies, so you have to pay full boat for those. People say, well, the Affordable Care Act is so expensive, and so let's get rid of the Affordable Care Act and go directly to the, well, there you go. You're paying essentially the same price. Here's one I definitely, you definitely have to watch out for. Short-term medical. I see a lot of people on social media talking about short-term medical now that people are losing the Affordable Care Act. Short-term medical is essentially just a short little bridge, usually about 3 months. You can re-up it sometimes for a maximum of 3 years, but really, I mean, be very, very wary of those. Very wary. Number one, if you have any type of pre-existing condition, they only want really healthy people because they want to make a bunch of money. So if you have any pre-existing conditions, then yeah, you're not going to get a short-term medical policy. And if you do get one and you get sick, these are non-ACA compliant. With the Affordable Care Act, when it was passed, that's what the Affordable Care Act is. It's saying, hey, insurers, you have to cover people. You can't kick them off when they get sick. You can't kick them. You can't decline them if they are sick. And there's a bunch of other protections, consumer protections. But those short-term medical plans don't have those protections. They can pretty much do kind of whatever they want. So they can deny you to begin with, and if you get sick, they can deny you. They give all kinds of different caps. We're only going to cover this much. And so I would be very, 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 very wary if you check those out. Other options out there, healthcare sharing ministries. Those are usually through kind of, religious organizations where they kind of pool money together and take care of each other, but there's no guarantees on those. I've seen some that have been okay temporarily, and other ones, as soon as people start getting sick and start needing the help, then it's like, okay, yeah, we've run out of money, so be very careful on those. And then there's another option, direct primary care memberships. But if you can afford one of those, you can afford the Affordable Care Act. Those are where you kind of make a deal with a hospital group or a doctor or something like that. It's kind of like the old, you hire a lawyer, a prepaid lawyer type thing. It's kind of that type of situation. It's kind of a concierge health care, with a particular set of doctors that you're paying them every month or something like that. So those are the options out there. Not, the first 2 or 3, Medicare, Medicaid, state programs, employer. Those are kind of the gold standards. If you can get into one of those, other ones, be very, very wary. Reach out to your politicians. It doesn't look like they're going to extend the subsidies. And the only reason the subsidies exist to the level they are is because they got rid of the mandate. And that was a conscious decision to get rid of the mandate, destroy the system, and it's working perfectly to people that don't want the system. So, so our new healthcare plan is the emergency, bankruptcy, and higher costs for everyone. And that is what we have decided to choose as an American public. So no other country in the world has a system like ours. No other country in the world has pre-existing conditions for most part. If you that's the entire part of healthcare. If health insurance, if you need care, you need healthcare. Yeah, pre-existing condition is pretty much, unknown in the rest of the world. All right, so let's get into some questions here. Before we started, someone has 4 Calico Gal says, you mentioned in a past stream that SSDI is good for 100 years, yet regular Social Security will be reduced in 2032 if nothing is done. How is the funding different? It's exactly, the funding is the same exact. It comes from FICA taxes, pays out of your payroll taxes. But part of that goes into OASD, the old age of survivors insurance, and then the other goes into disability insurance. So if you're receiving disability benefits, you are receiving money from the Social Security Trust Fund. And this is what she's talking about here, that in 86 more checks, the 87th check is going to be cut by 23%, pretty much across the board for everybody. And that's consolidating these two trust funds. But basically there's the kind of the retirement spouse, surviving spouse trust fund, surviving children trust fund. And that's the one that's really hurting. And then we have another trust fund that is the disability trust fund. And then there's obviously another Medicare trust fund, Medicare Part A trust fund. But the disability trust fund is actually doing very well. It's estimated it's good for another 75 years. But this number here, the 23% cut, everybody Everybody, unless Congress does something, which they haven't in 40 years, unless Congress, the president actually does something, then we're all going to get a cut of 23% in the next few years. And that is consolidating those two trust funds. So it's assuming that, okay, Congress says, okay, we're going to start cutting your Social Security retirement benefits next month. Oh, wait a second, we've got some money in the Social Security Disability Trust Fund, so we'll raid that one and pay retirement benefits. So that's where this number comes up. It's an assumption that those two trust funds are going to be consolidated. Yeah, so it's playing a little bit of, politics, a little bit of sleight of hand with the numbers. Okay, let's see what else here. Time travel. Good evening. I've read that some will be turning to healthcare sharing ministries. Yes, but again, be careful of those. Those are only as good as, there's no guarantees there. It's the word of whatever person or organization runs that says, yeah, give us all your money, and then when you get sick, it'll still be here, unless they decided to take off with it or something. There is no real laws there that necessarily govern that. So be very, very careful of those. Felicia, good evening, Bella. Okay, someone welcoming everybody. Thank you. All right, so here's another question we had. Autistic adults who cannot function without support can be categorized for Social Security disability by meeting the criteria. Autism spectrum disorder. Yes, and it's spectrum. Anything that has that type of spectrum, that there are cases that people are out there that are autistic or, whatever their disability is, there is a spectrum of it, Those are always difficult, very, very difficult to get your disability approved, but it does happen every single day. So if you have any adult child, are they eligible for disability benefits on the parent's record? Yes. Number one, the parent has to be receiving benefits, either retirement benefits, disability benefits, or the parent is deceased. And if the child, I'm not talking about a minor child, we're talking about if you have a child that's 20, 30, 40, 50, 60 years old, doesn't matter. If they became disabled before the age of 22, that's the trick for the disabled adult child benefits. If they had to become disabled before the age of 22. So if the child became disabled before the age of 22, even though they're now 30 or 40, it doesn't matter. If you can prove the Social Security that the child became disabled before the age of 22, and they can file for benefits on your record, but you have to be receiving benefits. Again, either retirement benefits, disability benefits, or deceased. Don't like going to ER, rather see a private doctor. Yeah, if you can afford it, don't we all? And when the emergency room becomes the primary care physician for millions and millions of people, then those people that have, they all assume to have, if you have no money and by going to the emergency room, you're going to put your family's finances at risk and, suck up any type of minor savings you do have, then it's probably emergency. But you probably could have taken care of it if you had regular, health care. So the emergency rooms are going to be crazy. And it's even going to get worse in rural areas, because Medicaid is being cut back by $1 trillion. They throw it out this small little pittance of money to supposedly help the rural hospitals, but it's only a fraction of what is going to be taken away from those rural hospitals. So if you live out in the country, you're going to have even a harder time in the future with hospitals and emergency rooms and all the rest of it. So it's all one big beautiful bill. It's a beautiful thing, according to the politicians that passed it. Making everybody's life harder, except for those rich. The rich, yeah, they're going to do fine. It's time to buy a new yacht. I'm thinking the COLA is going to put me over the limit for Medicare, and my Part B won't be paid. For Medicaid, yes. That is a problem that, yes, every year. It really happened a few years ago when the COLA was 8.7%. A lot of people lost their Medicaid. So what Bill is talking about is that he's receiving Medicaid from the state, low income, low resources, but that 2.8% COLA for 2026, Bill's probably borderline there. And the 2.8 is going to put him over. But remember, the states, they also usually increase those income limits as well. So I don't know if your state has already decided. If you live in like Texas or Alabama or Georgia, then yeah, it'll be even tougher. Those states are really, really cheap. Utah likes to deny people for no apparent reason. But yeah, hopefully it doesn't. Remember to join the 24help.org and tell us about the situation in your particular state. Eventually, what we're going to do with this website, again, this is y'all's website. This is where you'll go in there and help each other out, kind of crowdsource help for like Medicaid, because Medicaid is different in all states. So the Medicaid discussion is for the entire country. But in the future, if we get a bunch of people from Texas or Alabama or Kansas or Florida, whatever the case may be, then what we're going to do is we're going to separate that out and say, okay, here's the group that is going to be talking about Florida Medicaid and how to, navigate that bureaucracy and how to contact those politicians and make sure it gets fixed and all the rest of it. But right now, until this is a brand new website, until we get more people joining and more people helping each other out, we'll just do it nationally.